Good morning to all. I am Dr. Ajay and today we will see yet another important topic, that is tympanic membrane. So, the tympanic membrane, why it is important? Tympanic membrane, as you say, the PGs will, those who are preparing for PGs will simply think, why this sir is putting this topic as a MCQ, or is this important? Yes, in the recent era there have been lots of anatomy MCQs with the tympanic membrane, and there have been lots of image based MCQs every year in the NEET or the AIMS or whatever competitive exam is concerned. So, for that we need to know some important MCQs with the tympanic membrane anatomy, and with the pathology what all the questions we can ask. This 20 minutes video will deal you with the tympanic membrane anatomy and the pathology concerned with the tympanic membrane. Hope this 20-minute video will be a revision for your exam, and for the pre-final years or the third year MBBS it is a very useful topic, as the tympanic membrane is a short note for you and it is a concept oriented class for you. So, without wasting much time we will go ahead with the class. Okay. So, tympanic membrane, in another colloquial term, it is also called as eardrum. Okay. So, tympanic membrane, the first important MCQ. Tympanic membrane is a part of external ear or the middle ear or the inner ear. A very easiest MCQ which most of you will forget in the exam or will make a simple mistake by thinking overconfidently. Okay. It is, tympanic membrane is a part of external ear. The pinna, external aortic canal, tympanic membrane all forms a part of the external ear and not the middle ear. Okay. So, the next one we want to know about the important anatomy of the tympanic membrane. So, in the anatomy of tympanic membrane, so we want to know, say what I have drawn is a tympanic membrane. So, what is the shape of the tympanic membrane? Next important MCQ. What is the shape of the tympanic membrane? It is almost a oval shape, not a circular shape, not a square, not a rectangular. It is a oval shaped structure. And what is the color of the tympanic membrane? What is the color of the tympanic membrane? It is usually, that is another MCQ, it is usually pearly white or grey in color. Okay. And the next thing what we want to know is, what are the dimension of the tympanic membrane? The dimension is, it is around 9 to 10 millimeter tall, okay, 8 to 9 millimeter wide, and it will be around 0.1 millimeter thickness. Okay. A MCQ which has been asked for years in PGI, which of the following statement is false regarding tympanic membrane? This will be one of the point. 9 to 10 millimeter tall, 8 to 9 millimeter wide, and 0.1 millimeter thickness. Okay. And the next thing what we want to know is, okay, say again I am drawing a tympanic membrane. Is it straight? Is the tympanic membrane straight? Or did I curve the tympanic membrane? It is curved. Okay. So, what is the angulation of the tympanic membrane? The next important MCQ. So, this will be the external aortic canal, this will be a part of the middle ear behind. Okay. So, what will be the angulation of the tympanic membrane? Tympanic membrane lies at an angulation of 55 degree with the horizontal. A very important MCQ. It lies at an angulation of 55 degree with the horizontal. Okay. And the next important MCQ, we need to know about the, what are the parts of the tympanic membrane. What are the parts of the tympanic membrane? Two parts. One is a pars tensa, other is a pars flaccida. So, which is pars tensa? This area of the tympanic membrane is pars tensa. Okay. And this area of the tympanic membrane is pars flaccida. So, this is pars tensa, this is pars flaccida. So, what are the difference between the pars tensa and pars flaccida? Why we have mentioned as why there are two different parts? What is the important points with the pars tensa and pars flaccida for a MCQ and for your understanding purpose? Normally, the tympanic membrane consists of three layers. The outer layer, which is a epithelial or a ectodermal layer, then the middle layer, which is a mucosal layer, and the inner layer. These are the three layers of the tympanic membrane. For an undergraduate understanding purpose, there are three layers of the tympanic membrane, and these three layers are present in pars tensa. Okay. But pars flaccida contains only two layers. the middle layer is absent, that is it contains only the outer layer and the inner layer, the middle mucosal layer is absent. So, this is one important point, and the next important point is regarding annulus is concerned. So, what is annulus? So, annulus is nothing but it is a thickened rim of tympanic membrane. So, the tympanic membrane never lies straight, as I said it lies at an angulation. So, how it is lying? It lies in some sulcus over the external artery canal, that is called as the tympanic sulcus, and this tympanic annulus gets attached to the sulcus. Okay. And the important MCQ here is the tympanic sulcus is present only in pars tensa, and the pars flaccida has no tympanic annulus. Okay. There is no tympanic annulus in pars flaccida, but the annulus is present in pars tensa. Another important MCQ, the annulus is absent in pars flaccida. So, they may ask you which of the following statement is wrong regarding tympanic membrane. For that we need to know these points. Okay. And the next thing is, what are the quadrants of the tympanic membrane? Say now again I am drawing a tympanic membrane. As I said, it lies at an angulation of 55 degree. So, how will you divide the quadrants? How are we dividing the quadrants? One line, draw a line along the handle of malleus, the next line along the umbo. I will explain what is umbo and what is the handle of malleus in a short time. Okay. When you draw a line along these two things, we are dividing the tympanic membrane pars tensa into how many quadrants? 4 quadrants. Okay. 1, 2, 3 and 4. Okay. Just have it in mind, we will come in the next slide. So, the next important MCQ which is concerned is, what is the most important landmark seen in the tympanic membrane? The most important landmark seen in the tympanic membrane is, so when you just see this picture, what is the thing which is prominent in this picture? This area, this is the most prominent one. So, when they ask you the most prominent landmark on the tympanic membrane, this is nothing but this is a part of the malleus, and this area is the handle of malleus. The most prominent landmark on the tympanic membrane is a handle of malleus. Okay. But when they ask you the most prominent landmark and they didn't give this option and they gave some other option, just look for a point called as umbo. Umbo is nothing but this turn of the handle of malleus. The most prominent point is called as umbo. Okay. Umbo is a turn which is located just below the handle of malleus. Fine. So, when we look for the, so the next important MCQ which is concerned is, 1 minute. So, this is the tympanic membrane. So, this is the external artery canal. So, what is the cone of light? And 2 points with the cone of light. What is cone of light? Cone of light is due to which condition, and cone of light whether it is normal or abnormal, and it is seen in which quadrant. Okay, these are the 3 MCQs concerned with the cone of light. Cone of light is nothing but, why there is cone of light? It is nothing but when I am shining a torch of light here, the light is shining here, because of the angulation of tympanic membrane, this light goes in, okay, and it gets reflected back from the handle of malleus into a quadrant, into some quadrant. Okay. So, the cone of light will be whether it is normal or abnormal. It is normal. If there is a cone of light, if the cone of light is present, that indicates a normal tympanic membrane. So, never forget this, the cone of light is seen in normal person, not in abnormal tympanic membrane. The cone of light is seen in normal condition. Why there is a cone of light? It is due to the angulation of the tympanic membrane. The tympanic membrane is angulated, so it is due to the angulation of tympanic membrane. Okay, due to shining torch of light along the reflection of the handle of malleus. Okay, and then seen in which quadrant? Just have in mind. So, I am putting the third MCQ. It is seen in which quadrant? Antro-inferior quadrant. Antro-inferior quadrant. So, 3 MCQs with the cone of light. I am repeating. It is seen in normal condition. If it is absent or if it is bulging or distorted, that indicates some pathology. And this cone of light is due to the angulation of tympanic membrane. and it is due to the reflection of the handle of malleus, and it is seen in antero-inferior quadrant. Never forget this. Okay, antero-inferior quadrant. So, these are the 3 MCQs concerned with the cone of light. So, now here coming back to our previous picture, we are dividing it into 4 quadrants. So, here there is cone of light. So, cone of light is seen in which quadrant? It is seen in antero-inferior quadrant. So, what is this one? Antero-superior. What is this one? Postero-superior. What is this one? Postero-inferior. So, why I am drawing this one? So, if there is a MCQ like they are giving some perforation and they are asking you which quadrant is affected, you should be able to answer. Okay. So, these are the things regarding tympanic membrane anatomy is concerned. Okay. And these two are nothing but these two are the malleolar folds. These two are the malleolar folds, which is again important, which I will say later. These two are malleolar folds. Okay. So, coming on to the next important MCQ, the pars flaccida is otherwise called as, a very important MCQ, it is otherwise called as Sharpnell's membrane. Sharpnell's membrane. Okay, a very important MCQ, do not forget this. Pars flaccida is otherwise called as Sharpnell's membrane. Okay. And coming on to the next one, what is the mechanism of our hearing? The sound from the pinna goes through the external auditory canal and it vibrates the tympanic membrane. So, what it does? It vibrates the tympanic membrane. Okay. So, we need to know the next MCQ concerned with it is what is the vibrating surface of the tympanic membrane concerned. This is very important for our impedance matching mechanism in the ear, which I will discuss in some other class. Okay. So, what is the effective vibrating surface of the tympanic membrane? The total, we need to know the total surface area of the tympanic membrane. Total surface area of the tympanic membrane is around 90 millimeter square. Okay. But not the entire surface area of the tympanic membrane is vibrating. It is only the center part. Okay, center part of the tympanic membrane is only is important in the sound conduction. This effective vibrating area is around 55 millimeter square. Okay, this is another important MCQ concerned with the tympanic membrane. Okay, so coming on to the next one. So, as we have discussed, we have almost covered the anatomy aspect, we have almost covered the physiology aspects of the tympanic membrane. So, then we will proceed with the pathological aspects of the tympanic membrane. So, what are the pathological aspects? The pathological aspects means those concerned with the diseases of the ear. Okay, I am not going to explain in depth, but I am just going to put a picture. I am going to explain the condition or the diseases with the tympanic membrane, and that is important for your image based MCQ or a case scenario, whatever. Okay. So, what are the conditions which I could see, which I could diagnose with the tympanic membrane? Say when you are seeing with the Bull's lamp or when I am seeing with the otoscope, whatever, I could see only up to the tympanic membrane. So, the tympanic membrane is an indicator of middle ear diseases. Okay. So, the patient may come to you with the ear pain. Okay. Can you see the middle ear? No. I could see only the tympanic membrane. The patient will ask you, doctor sir, you just saw the external ear, but how are you saying that I have a disease with the middle ear? That is the tympanic membrane is an indicator of middle ear disease. It is an indicator. So, what it indicates, I will first explain with the picture, I will first explain with my diagrams, and then I will put a image based MCQs which have been asked in the exams. Okay. So, what it indicates? What it indicates? Say now I am drawing a diagram of the tympanic membrane. Just say me whether it is normal or abnormal. So, I have drawn a diagram of the tympanic membrane. Okay. And I am drawing this cone of light. Okay. So, whether it is normal or abnormal, what I could say? Just see the tympanic membrane. This is a image based MCQ. Okay. I am seeing for the handle of malleus, which appears normal. I am seeing for the cone of light, whether it is normal or not, it is normally present. So, this indicates this is a normal finding. Okay. Say now again I am drawing a diagram. Now I am drawing a diagram of the tympanic membrane. Okay. Here this is the tympanic membrane. Okay. And within the tympanic membrane, in the tympanic membrane, I could see some hole like this. okay, and I am not able to see the cone of light. The cone of light is absent. So, what it indicates, whether it is normal or abnormal? It is abnormal. The cone of light is absent and I could see some perforation in the tympanic membrane. So, what condition it indicates? If there is a perforation, then it should be some chronic suppurative otitis media with some perforation, that is a central perforation. Okay. So, here the perforation involves which quadrants? It involves the cone of light should be somewhere here. So, it involves the 3 quadrants, antero-superior, antero-inferior, and almost it involves the postero-inferior quadrant also. Okay. So, that is not much important, you need to know. So, if there is a perforation, so will there be cone of light? The cone of light is usually absent and I could see a perforation. So, this is an indicator of, when I see I am seeing a patient with a ear discharge in a OPD and I am seeing a hole in the tympanic membrane. That indicates the patient is having a chronic suppurative otitis media with a perforation. Okay. So, you can't describe it as a chronic or acute with this, it could be acute suppurative otitis media also. If it is present for more than 3 months, then it is chronic. Okay. So, this indicates a suppurative otitis media, whether it could be acute or a chronic, whatever. Okay. So, next one, again I am drawing a picture like this. Okay. Here I could see a cone of light. Okay. But I could see a cone of light, but the cone of light seems to be somewhat distorted. It seems to be somewhat distorted. The cone of light is distorted. Okay. And I could see some fluid bubbles within the tympanic membrane. Fluid bubbles or air bubbles within the tympanic membrane. So, the tympanic membrane is normal, there is no hole, but it appears a bit bulging, okay, and the cone of light seems to be distorted, and on examination I could see some fluid bubbles in the tympanic membrane. Okay. So, what it indicates without the history, I am not giving you any history, but this is a picture, presence of air bubbles or presence of fluid bubbles within the tympanic membrane without any perforation indicates a which condition? It indicates a SOM again, but this S is serous otitis media, not a suppurative otitis media, which is otherwise called as serous otitis media, otherwise called as glue ear, right? Clear? Serous otitis media or a glue ear, which is more common in children. Usually the patient does not present with a ear pain, the patient will present with ear blocking sensation. A child comes to you with the ear blocking sensation. On examination, I could see some presence of fluid bubbles inside the normal tympanic membrane, but the cone of light seems to be distorted. It indicates a serous otitis media. So, this is a third condition. Okay. So, these are very important MCQ. Serous otitis media is very important MCQ. Okay. So, coming on to the next important MCQ. So, again this was asked in last year Ames pattern MCQs. Okay. So, I am putting a diagram like this, I am putting a diagram of the tympanic membrane, okay. But I could see, what I could see, these are perforations, okay. These are perforations and I could see multiple perforation involving the tympanic membrane. How many? There are around 3 perforations involving the tympanic membrane, okay. So, these are multiple perforations involving the tympanic membrane. So, these multiple perforation involving the tympanic membrane, okay. So, here I could see some multiple perforation involving the tympanic membrane, okay. These multiple perforation involving the tympanic membrane is seen in which condition? This is again an indicator, a very important MCQ which was asked in last year, okay. The multiple perforation seen in the tympanic membrane is seen in 2 conditions, either it could be traumatic, okay, or the main condition is tuberculous otitis media. Tuberculous otitis media presents with multiple perforation in the tympanic membrane, which was asked in last year MCQ, okay. So, traumatic usually they will not give in the option, so you can just forget it. It is tuberculous otitis media, which is a indicator of multiple perforations, multiple painless perforations, okay. So, the characteristic feature will be there will be 4 clinical characteristic features. The patient will have a pale tympanic membrane, painless tympanic membrane perforations, multiple perforations, and the hearing loss will be out of proportion, disproportionate hearing loss. Okay, disproportionate, that is the patient will have more amount of hearing loss compared to the size of the perforation. These are the 4 characteristic points concerned with the tuberculous otitis media is concerned, a very very important MCQ. So, this is the 4th condition. Okay. Coming on to the next one, this is again asked in last year part. Okay. I am drawing a tympanic membrane here, here, here. My cone of light seems to be distorted, and whether is my handle of malleus normal or abnormal? My handle of malleus, the handle of malleus seems to be somewhat shortened. So, if this should be the normal handle of malleus, okay, it appears to be foreshortened, right, and these malleolar folds appears to be more prominent. Malleolar folds appears to be more prominent. Okay, and as I said, the cone of light seems to be distorted. So, these 3 points indicate which condition? So, the handle of malleus seems to be foreshortening of the handle of malleus, the malleolar folds seems to be more prominent malleolar folds, and the cone of light seems to be distorted. This occurs in which condition? When the tympanic membrane is retracted. This indicates a retracted tympanic membrane, the 3 points. Okay, note it down, the 3 points. This is a retracted tympanic membrane, again a last year MCQ, and this is seen in which condition? This is seen in Eastration tube block, when the Eastration tube is blocked. Okay, then there occurs a retracted tympanic membrane, which will be in impedance. What is the type of impedance finding? It will be a C type of curve. Okay, that means there is a negative pressure in the tympanic membrane. So, the Eastration tube block will appear with the retracted tympanic membrane. So, this is the 5th condition. Okay. So, these are important conditions concerned with the tympanic membrane what we are discussing, and I will show the images also at the end. So, the 6th one, coming on to the 6th one. Okay. So, now before going to the 6th one, in the 6th one again the same condition, the patient is having a retracted tympanic membrane, but now retracted tympanic membrane. Okay, but now the patient has travelled with the flight. Yesterday the patient said that he came from Dubai to India through flight. Because of corona he just escaped and came here. Okay. So, this retracted tympanic membrane following some air travel, okay, following some flight travel indicates a barotrauma, a 6th condition. Okay, never forget it. Okay, barotrauma. Okay. So, barotrauma is following flight travel or following some deep sea diving or underwater diving. Because of the negative pressure, the Eastration tube will get blocked and the patient will have a retracted tympanic membrane. Okay. So, coming on to the next one, the 7th condition, again the tympanic membrane here. Okay. But now the tympanic membrane will appear like a tympanic membrane. The patient comes to you with a severe ear pain and a fever, and on examination of the tympanic membrane you see some alloy wheel kind of appearance in the tympanic membrane. This indicates a sign called as cartwheel sign. So, cartwheel sign is seen in which condition? It is seen in acute suppurative otitis media. And which stage of acute suppurative otitis media? It is seen in pre-suppurative stage, that is the infection is about to get bigger. Okay, that is seen in pre-suppurative stage of acute suppurative otitis media, a very important MCQ. That sign is called as cartwheel sign. It is like a alloy wheel, like a spokes of alloy wheel. It is because of the blood vessels gushing along the periphery. Okay, this is the condition number 7, which is seen in ASOM. So, coming on to the next one, As I said, I will discuss some 8 or 10 points with the pathology of the tympanic membrane is concerned. I will discuss some 10 points with it. So, this is the next condition. Okay. So, here I could see a normal tympanic membrane. Okay, the handle of malleus is okay, the cone of light is okay, I could see a normal tympanic membrane, but I could see some okay, 1 minute. The patient is clinically normal, except that the patient have some ear blocking finding, and this the tympanic membrane is normal, the handle of malleus is normal, the cone of light is normal, but I could see some pearly white mass. This is a pearly white mass, sorry for the white picture, behind a normal tympanic membrane. So, pearly white mass behind a normal and intact tympanic membrane. What it indicates? What it indicates? This indicates a congenital cholesteatoma. Another important, very important condition which is an indicator of middle ear, the congenital cholesteatoma, in which the tympanic membrane seems to be normal, but you could see some pearly white mass behind a intact tympanic membrane, pearly white mass behind a normal tympanic membrane seen in congenital cholesteatoma, a very important MCQ, and this criteria is called as, what is the criteria named as? It is called as Levinson's criteria. Another important MCQ. What all I teaching now is a MCQ point. So, Levinson's criteria is seen in which condition? It is seen in congenital cholesteatoma, and in congenital cholesteatoma you could see some pearly white mass behind a normal tympanic membrane. So, coming on to condition number 9. Okay. So, here I am drawing a tympanic membrane again, and I could draw a cone of light again. The tympanic membrane is normal, except that here I could see some chalky white deposits along the tympanic membrane, chalky white deposits on the tympanic membrane. Okay, it is something like a chalky white patches on the tympanic membrane. What it indicates? This indicates a tympanosclerosis. The chalky white patch on a normal tympanic membrane indicates a tympanosclerosis. Usually it is normal, I will show the picture at the end. Usually it is normal, but sometimes it can produce a blockage in the hearing. They may give a image based MCQ like this and forget the blue and consider this blue as a white one, a chalky white patch in the tympanic membrane, and that indicates a tympanosclerosis. So, coming on to condition number 10. Okay. So, again I am drawing a tympanic membrane like this. Okay. And here the tympanic membrane is intact, as I could draw the cone of light. Okay. But here I could see some I could see some red swellings along the tympanic membrane, along the floor of the tympanic membrane. So, in this condition I could see some red swelling or a red some mass arising from the floor of the tympanic membrane, seen arising to be from the floor of the middle ear, which is projecting in the tympanic membrane. Okay. Floor of the middle ear seem to be arising from the tympanic membrane. Okay. And the tympanic membrane is normal. So, what it could be? What condition it could be? The patient presents with some mild tinnitus, which the tinnitus is somewhat ringing or pulsatile in character. Okay. This condition is called as rising sunshine. Seen in which condition? It is seen in glomus tumor. Okay. Rising sunshine seen in glomus tumor. So, this is again very important indicator of the middle ear. So, glomus tumor, it is called as rising sunshine, and I could see some mass kind of thing arising from the floor of the middle ear. Okay, that is which is seen through the tympanic membrane and is called as rising sunshine in the tympanic membrane. Okay. So, coming on to the next condition. Again here the tympanic membrane appears to be flamingo pink appearance. What I said, the normal color of the tympanic membrane? The normal color is pearly white in color. Here the tympanic membrane is a flamingo pink appearance of the tympanic membrane, seen in which condition? It is seen in otosclerosis. Otosclerosis, and that condition is called as Schwartz sign positive. Schwartz sign is nothing but a flamingo pink appearance of the tympanic membrane is called as Schwartz sign, and it is seen in which condition? It is seen in otosclerosis. It is seen in otosclerosis. Another important MCQ is concerned. This indicates, the Schwartz sign indicates a active focus of otosclerosis, that is active focus of disease modeling activity is being going on. Okay. So, this is condition number 11. The next condition, here the tympanic membrane appears to be something like a, it is something like a blue tympanic membrane. The tympanic membrane is there, and inside I could see some bluish color of the tympanic membrane. So, bluish tympanic membrane is seen in which condition? It is seen if there is a effusion inside the middle ear, that is seen in hemotympanum. Again important MCQ, a patient blue colored tympanic membrane is seen in hemotympanum, or sometime it can be seen in even blue ear also with the effusion of fluid, but blue colored tympanic membrane it is seen in hemotympanum. Okay. So, these are the various pathologies concerned with the tympanic membrane is concerned, and the tympanic membrane, as I said, it is an important indicator concerning with the middle ear diseases is concerned. Okay. So, I will just put on some pictures to explain you. So, here how is the tympanic membrane? Here the tympanic membrane appears to be normal, the cone of light is present, but I could see some air bubbles inside the tympanic membrane, that indicates a condition of serous otitis media. Very important one, serous otitis media, last year image based MCQ in your aims. Okay. And coming on to the next one, here what is the condition here? Here is there any perforation? I couldn't see any perforation since the cone of light is there. Okay, this does not appear like a perforation. Okay, but here the angle of malleus, it appears to be shortened. Okay, and here this is attic area, which attic or the pars flaccida area, which again appears to be retracted. This indicates a tympanic membrane retraction seen in Eustachian tube block. So, with the image based questions we can easily answer what is the diagnosis of the tympanic membrane. Okay, coming on to the next one, here what I could see? Here I could see some big perforation in the tympanic membrane, that indicates a suppurative otitis media. Usually it will be a chronic suppurative otitis media with a perforation. What perforation is this one? This involves almost all 4 quadrants, right? All 4 quadrants. If all 4 quadrants of involve, that indicates a subtotal perforation. Subtotal perforation is a perforation involving all 4 quadrants. Okay. And here what I could see? I could see some multiple perforations involving tympanic membrane. Multiple perforation seen in which condition? Tuberculous otitis media. Okay. So these are the conditions concerned with the tympanic membrane is concerned. Hope this will be very useful for you in the practical approach of the applied anatomy of the tympanic membrane and the approaching the questions with the tympanic membrane is concerned. Okay. Thank you. If you have any doubts, or if any queries, or any if you want further suggestion with the tympanic membrane, you can catch me, you can just mail me in this number, in this mail ID, ajaimuthu@yahoo.co.in, or you can WhatsApp me in my number. Okay, or you can comment in a Telegram group, in my Telegram group, or you can comment in my Facebook group also. Thank you.